Well, I want to start with an interesting story. It again builds on that chance theme. But I guess one of the reasons that I've been able to play a major role in the mental health policy environment nationally is because David Goldblum, who was on our board, um, introduced me to Michael Kirby in 2005. And it's interesting because when Senator Kirby was doing his report Out of the Shadows at Last, I had had an opportunity to meet Senator Kirby. I gave him all the material that I was known for, and he never even responded to my email. And David Goldblum, who became the chair of the Mental Health Commission of Canada following Senator Kirby, David was a personal friend of Mike's, and Mike wanted to speak to somebody who knew something about community mental health when he was writing his report Out of the Shadows at Last. So, notwithstanding that I'd already sent most of my brains via email to Mike, David arranged a dinner. And that dinner with Mike Kirby solidified my relationship with Senator Kirby. I helped write the Out of the Shadows at Last report, did the funding analysis for them. And then, I guess as my reward, I was asked to chair the Service Systems Advisory Committee for the Mental Health Commission of Canada. And I believe that played a major role in the commission being able to focus on what was important in terms of improving mental health systems in the country. It certainly resulted in the establishment of the target I spoke about earlier, the 9% target. So that's one of the things I'm particularly proud of, but I actually owe a debt of gratitude to David Goldblum, because if David hadn't introduced me to Senator Kirby, I might have been still talking to myself. And of course, that led to some interesting opportunities. Some of my colleagues who observed my national work were motivated to nominate me for the Order of Canada, and I received that in 2016. It's something I'm very proud of. And then Camille Kenville, the executive director of CMHA Ontario, nominated me for the Difference Makers Award that CAMH gave a couple of years ago. So I think those are achievements. But again, I think it's been my luck to sort of be in the right place at the right time. The other, and again, it ties again to just always be open to possibilities. In 1999, CMHA had its national conference out at UBC in Vancouver, and I was walking across the campus, and Professor Wes Shera, who was the dean of the Faculty of Social Work, approached me, and I had applied on a number of occasions to teach at the faculty, but always been because I didn't have a PhD and people didn't necessarily value what I brought to the sector, at least academically. I wasn't given a chance to teach. But Wes approached me and said, "Look, Steve, I know the great work you've done because I'd lectured to his class." And he said, would you be prepared to teach my course next year? I'm going on sabbatical. Well, 21 years later, I'm still doing it. So again, I've really appreciated the opportunity to educate over 1,000 social workers on health and mental health policy. And I think hopefully that makes a difference as they get an understanding of the context of the environment they work in, some of the issues about funding, and the need to, as we do at CMHA, focus on programs in the community, focus on getting funding in the community, and doing those things that make a difference in people's lives.